Hi, hello, welcome to my YouTube channel, All Nursing MCQs. Which valve prevents backward flow of blood into the left atrium? Options are aortic valve, pulmonary valve, tricuspid valve, mitral valve. Answer is option D, mitral valve. Heart sounds are the result of options are movement of blood into the heart from the aorta, blood flow through the heart, closure of the heart valves, contraction of the cardiac muscles. Answer is option C, closure of the heart valves. Which is the longest vein of the human body? Options are great saphenous, popliteal, iliac, femoral. Answer is option A, great saphenous. Which of the following tests can be used for the diagnosis and assessment of the severity of heart failure? BNB, PSA, troponin, ANA. Answer is BNB. Option A, BNB, because BNB is secreted by the ventricle in response to excessive stretching of heart muscles. Nurse giving oxygen therapy should know that it has to be humidified because options are oxygen is a hot air and it may burn trachea. Oxygen is a dry gas and thicken the mucus. Oxygen get cleaned off pathogens by humidification. Oxygen is easily absorbed because it add H ion to it. So the answer is option B. Oxygen is a dry gas and thickens the mucus. PEEP in ventilator helps to. Options are prevent collapse of alveoli, prevent oxygen toxicity, prevent ventilator fighting, avoid overventilation. So the answer is option A, prevent collapse of alveoli. Which among the following is a criterion to classify a death as brain death? Options are presence of EEG activity, cessation of breathing, responsive to deep pain, hypothermia. So the answer is option B, cessation of breathing. Dehydration in human body caused due to options are loss of water, loss of salt, loss of vitamins, loss of minerals. So the answer is option A, loss of water. Solution of choice for bladder irrigation for a patient who is undergoing TURP, transurethral resection of prostate. Options are glycine, normal saline, ringer lactate, isolate P. So the answer is option A, glycine. Other name for genupetral position is options are lithotomy, Trundleberg, Nietzsche's sim position. So the answer is option C, Nietzsche's. While triaging, which of the following clients should be given priority treatment? Options are an unresponsive head injury client, patient with a brain injury of 55%, patient with sucking chest wound, patient with clavicle fracture. So the answer is option C, patient with sucking chest wound. All among the following are cellular adaptation except options are hypertrophy, hyperplasia, atrophy, metaplasia. So the answer is option C, atrophy. Transportation of triglycerides from liver to adipose tissues is the function of which of the following lipoproteins? Options are low density lipoprotein, intermediate density lipoprotein, very low density lipoprotein, high density lipoprotein. So the answer is option C, very low density lipoprotein. The inactivated polio vaccine should be preserved at options are 2 to 8 degrees Celsius, below 0 degrees Celsius, minus 2 to minus 8 degrees Celsius, 0 to 4 degrees Celsius. Answer is option A, 2 to 8 degrees Celsius. Dose of BCG vaccination is 0.5 ml subcutaneous, 0.5 ml intradermal, 0.1 ml intradermal, 1 ml IM. So the answer is option C, 0.1 ml intradermal. Suicidal tendencies are least common with options are alone, depression, male, married person. So the answer is option D, married person. Recurrent suicidal tendencies are seen in options are schizophrenia, severe depression, borderline personality disorder, all of the above. So the answer is option D, all of the above. Stimulation of which of the nerve leads to elevated mood? Options are median nerve, radial nerve, ulnar nerve, vagus nerve. So the answer is option D, vagus nerve. All of the following informations are sought in the well baby clinic except options are schooling, breastfeeding, sleep pattern, child growth and development. So the answer is option A, schooling. Babinski sign is considered as normal in options are newborn, adolescents, youth, older adults. So the answer is option A, newborn. Rooting reflex in infant disappears at options are 1 month, 3 to 4 months, 6 to 8 months, 9 to 12 months. So the answer is option B, 3 to 4 months. The leadership style in which the leader alone determines policies and make plans. Options are democratic, autocratic, bureaucratic, laissez-faire. So the answer is option B, autocratic. Acknowledging the performances of an employee is through the way of options are self-assessment, performance appraisal, rewards, appreciation. So the answer is option B, performance appraisal. Which of the following is the unit of measurement in bacteriology? Options are joule, Newton, micron, Pascal. So the answer is option C, micron.